Hi, my name is Mohammed. So, February 1st, 2024, I had my gallbladder removal surgery. It was laparoscopic. So, just wanted to share my experience through it before surgery, after surgery. Because if you're watching this video, then you're probably thinking of doing the surgery, or you have stones and you want to remove your gallbladder. So, without delaying it, let's start. So mine was done on Thursday, February 1st. Today is 5 days later. We're on Tuesday. I guess is the 5th. Yes, it's the 5th. No, 6th today, 6th. So it's been 5 days already since surgery. So let me go backwards and let's talk about before surgery. So they told me the night of, do not eat anything after 12 a.m. So I didn't have any food, nothing to drink. They said no Tic Tacs, no Lifesavers, none of that. Don't have anything for a week before. You can't have any kind of ibuprofen, Aleve, or anything like blood thinners or whatnot. So no kind of medication before that. So the day of, supposed to have my surgery at 12:45, and then I got a call in the morning. So we're supposed to be there at 10:45, and they say that, hey, you've been delayed. So I'm already, hungry, didn't eat. I'm like, all right, no problem. Just gotta wait a little longer. So I got delayed until 2. Show up at 12. So we showed up at 12, and then first went to pre-registration there, and then from there they said that, hey, you're gonna have to move to the next part and your wife will join you shortly. So I said, okay, no problem. So I go there. The first person that was there said, go ahead and change into your gown. Here's a bag, put all your clothes inside, put everything inside there, and we'll make sure you get it later. Nothing on, just your socks and the socks that they give you, obviously, and then they give you a head cap, and they also give you lost the train of my thought right now, but the gown. So now, once that was done, the nurse came to prep the area because I'm having the gallbladder surgery. They repeatedly ask you, what's your date of birth, what's your name, what are you here for, what are you here for, what are you here for. Obviously, don't get annoyed or anything, just say it. What are you here for? Gallbladder removal surgery. Because in the past I had ACL repair done to my left knee, and obviously they come in and they keep asking you, what are you doing? Because you don't want to wake up and have it done on the wrong knee, right? So we're doing gallbladder removal surgery. Don't want to wake up with missing kidneys or whatnot, but it doesn't happen, but it couldn't happen. You never know. So waited. Once they prepped it, gave me some medicine, then they gave me the IV on my right arm, put the blood pressure machine on my left arm, and continuously had that there to measure it. Then they said the doctor's gonna come in. So the doctor came in, and then the doctor explained everything. That's when they brought my wife and explained everything to me. And then after they explained everything, the doctor left, and then the anesthesiologist came in, and then that person explained everything to me. So obviously it's all medical terms, jargons, whatever you want to say. Doctor is straight through. Do you have any questions? No. The anesthesiologist was straight through. Do you have any questions? No. Let's just get this over with. That's all I'm thinking inside, right? So afterwards, they said, okay, you have to use the bowel movement, anything that you have to do to empty your bladder, or, like if you have to do 1 or 2, let's go. So they took me, they helped me because I have the IV on and the bag is on. They took me, we went, we did it. I used the bathroom, and obviously you got to ask for assistance because you have the IV. So they come and they take you back out of the bathroom. That was done, got me back on the bed, put my blue hat on, and they said, okay, time to go. So I said bye to my wife. As I was going, one of the nurses was, joking with me, and she said, make sure you keep that party hat on because you're going for a party. I was like, yeah, a party. Sure, to remove my gallbladder is a party, and the other nurses and them, they're laughing. Go inside the OR, and in the OR, I went, and they told me to transfer myself from one table to the other. And typically once you're transferred, and then the anesthesiologist puts the oxygen and gives you the medicine to knock you out. But for some reason, they haven't knocked me out yet. And then tie my right arm, then tie my left arm, then tie my legs, my lower portion of the body. I'm like, all right, now this is freaking out because now I'm being a little wrapped up, right? But obviously I know why, because if you have a breathing tube and then, they're cutting you and you just wake up, anesthesia wears off, something happens, right? In a case, they don't want you ripping stuff off, which is good. So, but obviously it creeps you out. And the anesthesiologist goes, hey, we're administering the medicine, you're gonna feel it shortly. And like that, I was gone. Next thing I know, I woke up, felt cuts on my abdomen, and I was in pain. So I asked the nurse, can you check how many cuts? And obviously the nurse told me I had one on my belly button, which is 5 millimeters, and 3 along my belly, which was basically on the left side 8 millimeters, on the right side 8 millimeters, and in the center I had 12 millimeters. Hopefully I'm right with those. And they did internal stitches that dissolve or something, and then on top they had Dermaban or Dermabond. I don't know how you pronounce it or not, but they had those, and they basically fall off in like 10 days or something, like 2 weeks, 5 to 10 days. With those, you can get them wet, but you don't want to lather it in water or anything, so you can take a shower the next day. You gotta not be in the direct shower, you should turn and whatnot. So that is there, you can shower, that's a good thing. You don't have to follow back up with the surgeon to take the stitches out, so that's also a nice thing. So now they did that, I was in bed, I'm just laying in pain, and then the nurse asked, do you want medicine? I said, yes, I'm in pain. So she helped me out, get medicine. I said, please, can I get some ice chips? Because at that time, you're thirsty, you're hungry, and obviously you don't know what's happening, right? So I said, can I get some ice chips? Those ice chips taste so good. Obviously, they're just ice chips, but for a person who hasn't eaten, who hasn't drank anything, it's a lot. And then, you know, I kept going in and out. My wife told me it was probably like an hour and a half or something like that I was knocked out. And they brought me from phase 1 to phase 2. So that part of the recovery, first I was laying down in the bed. Now phase 2, she's actually with me, where they sat me up and on a more like an incline or reclined couch. And they're like, here, we're gonna have to get 3 vital signs to see that you're good, and you have to do one, like you have to basically urinate, right? You have to go to the bathroom. You have to see it's successful. You have to eat something and not vomit. So they gave us, you know, like graham crackers or cookies or anything you want to pick from, and then what do you want to drink? I said coffee. So I had a cup of coffee, and I had like 1 piece of graham cracker, and I bit into 1 Oreo, and I felt sick because it's too sweet and just want to throw up, but I didn't. Once they saw that I was good, I used the bathroom 1 time. Very, very dizzy, but the nurse assisted me, went there, did it. Then the other person helped me, wheeled me back to my car. My wife drove me home. On the journey, I would advise that the ice pack that they give you, hold that a little more pressure towards your tummy, because when you're pressing it, it doesn't let everything rock from side to side. And then what happens is that you don't feel all the bumps. So in the beginning, I was feeling all the bumps, like my insides were, you know, turning out, and then later I didn't. So now we're going home. We're in the house, changing to something more comfortable because the pants were rising on my pant line and stuff. So went more comfortable. And then, yeah, for the first couple of days, it was tough trying to, you know, pass gas or anything like that, because they blow up your entire stomach with carbon dioxide inside there, and then you want to get all that gas out. So it's a struggle in the beginning, but you're scared that you don't know what's gonna happen. So first couple of days, I was able to pass gas. I was able to, you know, do number 1, and then I couldn't do a number 2, so I used stool softener and laxative as they told us. So I did that. For pain, the doctor said to do Tylenol and Motrin every 3 hours, alternate, you know, and then they gave me like a nerve blocker, which helped. Now 5 days after, I feel great in the sense that there's no more bloating. There was a lot of bloating, felt like my stomach was gonna pop, a lot of gas and stuff in there. Been having a lot of diarrhea because I've been having just soups, crackers, toast. We'll be introducing more solids soon, but they said low-fat diet for 3 weeks, so I'm trying to you know, adhere to that. If you're interested in getting your surgery, there's a lot of stuff that goes with it, but it's a same-day procedure. If you have a stone, if it's inflamed, like I did get reassurance, because when the surgeon did say after he took my gallbladder out, because of the big stone, it was actually acute inflammation, they say. So it was inflamed, so it's bad. So thank God, you know, somehow they found it and they took it out. So I'm not complaining. If you are thinking about getting gallbladder surgery, hopefully this video helps you. And don't be nervous. I did it. You can do it. Other people did it. You know, it's just about everyone's recovery time. They say you should be back up and normal in 2 to 3 weeks. Don't lift anything more than 20 pounds. I feel like I'll be good in probably 2 weeks. Let's see. Thank you for listening, and hope you have a successful one. Bye.